Agenda number 6, we have a presentation by Martha T. Berry. Kevin Evans, would you like to come up? Thank you.
Good afternoon.
I don't understand.
I'm sorry.
So we will
Kevin,
add it to agenda.
Suri wanted to talk to you. It was off and Suri came on. Suri's got to go down here. I apologize.
Again, thank you so much. Today, just a quick summary. Our first quarter census, otherwise known as our occupancy, is low, but it's expected in some ways. Even though our census is low, our financial position has improved. We've had 2 audits, one from Abraham and Gaffney, that's our audit, independent audit, and then our Medicaid audit. We asked for an expedited audit that included 3 years, and we've also begun a number of capital projects and assessments we're talking about. First, our census. Year to date, our occupancy is at 92.7%, which is down from 2016 of 94.73%. This is still roughly 8% better than occupancy than the rest of the county and about 10% than the state. We are the provider of choice as the safety net in the community, and that is the number one reason why our census tends to be higher than those in the area. Some of the factors that are depressing our census right now is a number of facilities have been built that are brand new assisted living facilities. Our legacy reputation is a 1-star facility. We also have some pilot projects that preclude us from working with them, the insurance carriers, unless you're a 3-star. I'm excited about what's happening with our quality ratings. As we had talked prior, our 1-star, we had talked about the earliest we could impact that would be 3rd quarter this year. In 2015, we had 18 citations. 2014, there were 27 citations. So last year, I'm pleased to say we were at 11 citations. And this time last year, we had already had 3 citations, one of which was a G-level citation. But so far this year, we are citation free. We've had over 20 facility report incidents. Those are things that the state requires us to report, and they have found no deficiencies. So our quality is going in the right direction. Despite our depressed occupancy, our financial position has improved. In the first quarter, we launched our electronic medical record system, and we knew that our costs would be higher, so we lost a little bit of money from what we expected to. We are, however, back to managing our labor based on census. Our cash position has improved, and even though we have our Medicaid audit has come in with some negative numbers, we're still going to be in a pretty good position. Now, for those of you that are new to long-term care, I had mentioned the audit from the Medicaid system. Each year, we send a cost report in on all of our expenses. There are certain expenses that the state deems allowable and certain expenses that say are non-allowable. Among those, there are some that are in dispute, and depending on how the audit looks at it, they can choose to take some money back or not. The majority of the money that came back were based on census days, and on about $60 million, we're looking at about $300,000 that they're taking back from us. We'll have the final number next week, and I'll present that in this second quarter. But we have additional money that has come in through what is called certified public expenditure that'll easily cover that amount. So we will not be going into the hole based on that, and I'll talk about that in a minute. What I'd like to spend a couple of minutes talking about is our actual finance position. We are managed differently than a department that has an allocated budget. We are focused on an enterprise system, and this is something that is important for us to note because our revenues and our expenses do fluctuate based upon our census. So if we have more people coming in than expected, we will have more expenses. Now, that is different than a normal department budget that has an allocation that requires you to come and get more money to be able to provide more services and vice versa. what you have in front of you, and it's a little bit difficult to see, so I'll blow up some of the sections, and I've numbered them just for our ability to talk about it, is an excerpt from 3 pages of the monthly income statement that our board receives. Now, what we look at doing is having our operations have enough money to provide that year's capital budget so that we end up with a zero-based budget. This was something that I was told by the finance department and by the previous board chair that this commission likes to see. So I'll show that to you right now. Also, as we talked last year, when special monies come in, that should not be considered part of the budget but set aside. And I believe, Mr. Carabelli, you had asked us to do that last year, and you'll see that this is how it's represented here when we get to it. First is you'll see the net income. That right there is, on the right-hand side, is our budget. We expected to make $180,000 in the first quarter, and you see we only were able to have a positive $161,000. Now, if you take a look at where our capital projects are at, you take that same $180,000 budget, which is on the right-hand side, and that's the money that we expected to spend out of this year's budget. Now, you'll see here we spend a little bit more on that. And we do that for 2 reasons. One, we have a need. Second, we have money set in already in our cash account that was set aside for that. For some of the commissioners that have been here, we received about, about $860,000, maybe Steve can remember, that was left from money that is designated for capital. I don't have a way right now to represent that money set aside here in this. I'm going to be actually talking with Plant Moran as a way to be able to represent that. So for right now, just know that we have additional money set inside specifically to help with the building. But as you see on item 2, we spent a little bit more on capital projects. Item 3 is our certified public expenditure. You'll see that we received $869,060, but we did not budget for that. And we did that with intention. Our goal and our responsibility is to have a sustainable model at Martha T. Berry that is independent of any external money coming in. With that in mind, the CPE is a short-term revenue stream based on a couple of years ago, Finance Department working on refinancing our OPEB. So with that in mind, we're getting some of that money back from the federal government. That is something that is part of the federal reimbursement program under Medicare and Medicaid. We set that aside so that we can see that it's there, but we don't budget for it because we don't want to presume that it's going to be there forever. As a matter of fact, in 2022, federal rule says that it will be sunset. So we are not acting as if it's there from a budget standpoint. However, we have about $3 million that we know that we need to improve on over the next couple of years in capital. And it's our hope to use a portion of that as it comes in to help focus on the building and provide for the building and also shore up our cash position. Now, I believe that the report that you received on first quarter showed that we had a loss of about $26,000. And if you take a look at the capital projects being $7,000 over and our operations being $19,000 under, that's the $26,000 difference, as you see there. But you can also see that we received that $869,000 that nets us in a positive position. So we're in pretty good shape financially. And I believe last year, Commissioner Kleinfeld asked, how long will it take to get us out of a negative net position? This is something else that is different in an enterprise fund versus an allocated budget. We're required to represent our long-term liability on our bottom line. Audited, our net position as of 2015 was a negative $11 million. And that is that long-term liability that says if we had to close today, we would be $11 million short. I'm pleased to say that unaudited, we're still headed in the right direction. As you can see on item 4, even this year, our year-to-date net position continues to head in the correct direction. Now, recognize that those numbers are getting smaller because a negative big number is worse. All right, so we're hoping to turn that in the next several years over into a positive. My hope is every year we're looking at knocking at least $500,000 off of that negative net position. As you know, it's a difficult balance because we have a need of improving our physical plant. The competition is quite rich in the area with new buildings going up and remodels happening. So we have to balance the need to make sure that we have a sustainable model while at the same time improving the physical structure so that it's appealing to people coming in. We've begun working with Lynn over at Facilities and Operations, and I do want to formally say thank you to her. She helped in many ways to give us direction as to some vendors that the county was using that was already vetted through the purchasing process, so we could access the contracts that are already being used at the county without having the expense of rebidding. Also, she was incredibly helpful in us getting our request for qualifications for an architect for our kitchen and dining room renovation. So the current projects that we are working on is we're getting the generator engineering study. It is the second month underway. That is converting 2 generators that are 50 years old into 1 gas or hybrid generator that will handle the full facility. We're also going to be coordinating with F&O on that because they're going to be putting new infrastructure in, the power lines going underground both to us and to the jail. And if we coordinate that, we can save some construction costs together. Our door access control, we're able to access, no pun intended, the county commissioners or the county's contracts on that to allow us to get door access control at a very good rate on the county bids. Our call-out system, as I had mentioned in previous meetings, is over 17 years old, and we are we just received approval from our board to replace that. And then lastly, our kitchen and dining RFQ. We were able to get the RFQ on Mitten, and we had 40 vendors look at it. We had walkthroughs on 13 different organizations, and we will be getting their bids next week, and we'll begin opening and evaluating those. Lynn also agreed to give us some overview and help on that as well. That's all I have. Do you have any questions?
To add? Or any questions? No? Okay. Thank you very much. Appreciate your presentation.
Thank you.
Do we have a motion to receive and file? By Majek and seconded by Drolet? Drolet. Please vote. Okay, it's unanimous.